ahead and get started here. So again, my name is Dr. Marcus Stewart. I am the chiropractic and physical medicine doctor here at Align Modern Health here in South Loop. Welcome again to our digital series for the month about workstation ergonomics from home and the office. Here at Align Modern Health, we pride ourselves on giving gold standard care and integrative medicine, which aims to get at the root cause by looking at the whole person and not just one symptom or condition. So as a chiropractic physical medicine doctor, I deal with patients who have musculoskeletal pain, injury prevention and rehabilitation, even sciatica, arthritis, pregnancy pain, as well as vertebral disc pain and disc disorders. And then we even help athletes who want to keep up with being in peak performance shape. We also offer clinical massage therapy, who I work hand in hand with. And the massage therapist will help patients with muscle soreness, tightness, headaches, soft tissue strains and injuries, even anxiety and stress, as well as pregnancy patients, pre and postnatal, and fibromyalgia. Other services that we offer at our clinics are acupuncture, and they do help a lot of patients with stress, anxiety, and musculoskeletal pain as well. Even men and women's health, as well as infertility, definitely with fatigue, sleeplessness, and insomnia. They even offer some remedies with herbal medicine, as well as cupping and moxibustion. Our functional nutrition and clinical nutrition doctors help patients with weight management, food sensitivities, GI problems like bloating, constipation, diarrhea, as well as nutritional counseling. So we do offer an array of services here at Align Modern Health that help our patients getting better. Sometimes it takes a village to get back to help us get us back to normal, and we are that village to help patients get there. So again, my name is Dr. Marcus Stewart. Just a little background about myself. I graduated from chiropractic school in Dallas, Texas, from Parker University. Also graduated with a Master in Science and Practice Management. Before I went to chiropractic school, I attended the University of Texas at Arlington and received a Bachelor's of Science in Biology. And my passion is just helping patients with their musculoskeletal pain, as well as helping our athletes with sports injuries and helping patients with chronic pain and even family wellness. Okay, so like I said, we're going to be talking about workplace and workstation ergonomics from home and from the office. But first, you're probably wondering what exactly is ergonomics, or maybe we all have our own definition of what ergonomics is. But just in case, here is the Merriam-Webster definition of ergonomics. And basically they say that it's an applied science concerned with designing and arranging things people use so that people and things interact most efficiently and safely. So just making sure that our surroundings are working for us and with us so that we can effectively work throughout our day, but also, using these items safely for our spine and our health. So you're wondering, well, why even care about ergonomics? Why do we need to know about ergonomics? Well, ergonomics does matter because if you think about it, over time, when we overstress our joints and muscles, they can lead to injury and pain. So we call that repetitive movements. And that puts a lot of stress on our muscles and joints over time. Pain is always the last thing to show up, only after the tissues have been overstressed for so long, right? So we do often get patients that come in and say, doc, I'm not necessarily feeling the pain, but I may feel a lot of tightness here in my neck or in my back, But I know what that's going to lead to down the road is that pain. And you probably noticed that one time you had pain, but it went away, but you still felt that stress and that tension. So those joints and those muscles are still overstressed. And just our daily activities is enough alone to cause injury. So this is how people end up in that chronic cycle of pain relief, until it becomes more of a chronic pain every day, all the time. But I'm here to say that you can take some preventive efforts to limit that bodily stress and mitigate the effects of doing desk work. For example, here, as you can see, the most common areas here, of course, are our lower back and our neck, but also shoulder and wrist. And yes, I know this doesn't add up to 100%, so you're probably wondering why the math isn't mathing. But if you think about it, at any given day or any given moment, you probably have felt pain in 40 areas at one time. And sometimes it may feel like it's 100% in the back, but a little bit in the shoulder. So that pain may not evenly add up as far as the distribution. So you may have a lot of pain in the neck and back, but also in the shoulder and wrist at the same time. So here, when we're looking at our ergonomic workstation, we want to make sure that we have our elbows, our hips, and our knees at that 90 degrees. So that's a major point. If you don't remember anything else on this slide, remember elbows, knees, and hips, 90 degrees. But also looking at the computer and how it's eye level, as well as our keyboard and our chair are being parallel to our wrists. So the chair, you want to make sure we have some lumbar support or lower back support for you as well too, and keeping your shoulders back and down as you're looking at your screen, as well as making you have ample space underneath your desk and with your chair so that your legs can fit perpendicularly to the ground. Now, as you notice here, he also has a footrest. So if you feel like your feet are not able to be on the ground and have that 90 degrees with the hips, then you may find supporting your feet with a stable footrest can be very helpful here. So bringing us to our next slide, monitors. So thinking about our monitors, we oftentimes don't think about how close we sit to our monitors. Are we sitting this close? Are we back here? But having that monitor about 22 to 26 inches away will reduce eye strain. And it's commonly known that eye strain, due to those muscles in our eyes, can lead to headaches. So kind of having a headache behind our eyes. So if we're sitting too close to the screen for a long period of time, that will strain those muscles and can cause headaches as well. And then thinking about having that monitor right in front of you. So for those of you that work with multiple monitors, you want to have the monitor that you use the most right in front of you. So that way you're not constantly looking and turning the head. You might kind of get like a whiplash feeling if you're doing that all day for 8 to 10 hours a day and 5 to 7 days a week. So use the one that you use the most, have it right in front of you. Now the height of the monitor should be about 17 to 19 degrees above where you're looking. So that way you're not finding yourself looking down like this. Like the picture to the left, we don't want to arch our spine like this for a long period of time because that will cause overstress of those muscles and joints in your neck, upper back, and lower back. So the one on the right with the green check mark, this is ideally how we want to sit to mitigate having those overstretched joints and muscles from turning into pain and injury. So our next slide is going to talk about the keyboard and mouse placement. I think this is one of the things that often gets ignored because we don't think about, well, where should I put my keyboard or where should I put my mouse? And sometimes our desks and chairs don't, really computer desks don't really have a nice place to set up our keyboards and mouse. But if you can, you want to make sure you have that keyboard directly in front of you, parallel to your desk, and bring that keyboard closer to the edge of the table. That way you are able to hold your wrist in a neutral position, like the diagram there with the one on the left side in the green that says right, and then have that mouse be able to move more freely. Ideally like a wireless mouse, again, because if you think about what we do in and day out, those repetitive motions will create overstressed muscles and joints. So we have that keyboard too far in an awkward position or that mouse is tethered to the computer and we're not getting that free range of motion, that's going to cause a lot of stress on your joints and your muscles in your wrists and your hands, which can lead to different pain and ailments of the wrists and hand joints. So now head and neck posture. I'm sure many of us have found ourselves over the day leaning forward and over our computers like this. Well, guess what happens to your head as we do that all day? So for example, if we took a bowling ball that weighed about 8 to 12 pounds and we held like this, like right here, that bowling ball would probably be a lot easier to hold here. But what happens when we start to bring that bowling ball forward, right? It becomes a lot harder to hold and stabilize with it being forward and going downward. So the same thing with our head. Our head weighs about 8 to 12 pounds in that neutral position, but the further away and the further down our head is, the more it will weigh. So as you can see in the diagram here, your head can feel like it's weighing up to 42 pounds sometimes, being so far forward and down. And that's gonna make those muscles in your neck and upper back work a lot harder. So let's not work harder, let's work more efficiently by having our head and neck in a neutral position, and that way those muscles are not working so hard. And this will decrease the workload on what we call your computer muscles. So just remember, these type of things matter because, again, if you're at a desk for 8 to 10 hours a day, 5 to 7 days a week, those repetitive motions and repetitively putting our head down and forward will cause overstress of those joints in your neck and upper back. All right, so we talked a little bit about having our chair with lower back support or lumbar support. So for example here, there's a roll that you can use. Now, say your chair just doesn't have that support, you don't have that curvature for your lower back, you can have a roll like this, or even like rolling up a towel or having something that's cylinder and a little bit hard to put behind the small of your back. You want to be able to lean back onto it just enough so that your ears are in line with your shoulders. As well, if it gets uncomfortable, you can always move it, the bottom of it down and forward slightly, and then it will take some time to get used to. So I always recommend patients using it for about 30 to 45 minutes, and then maybe putting it to the side and then try it again another hour for another 30 to 45 minutes until they get used to that support in their lower back. So even if you don't have a support like this at home, you can always use like a rolled up towel or any kind of soft cylinder cushion to go behind your back. But we also have these on hand in all of our Align Modern Health clinics for sale as well too. So you can always stop in one of our clinics to buy one of these lumbar supports as well. All right, so standing desk ergonomics. I always get the question of, Doc, which one is better? Is standing better? Is sitting better? And I say, you know what, if you can't, alternate, because too much of either standing or sitting can be hard on our joints. So again, we're talking about repetitive movements. We're talking about overstressing our joints. So if you're standing too long with our legs crossed or we're leaning to the side, that can cause just as much damage to our joints as if you're sitting with your leg crossed and hunched over at your computer. So try to alternate between standing and sitting or getting up and moving around and stretching. But while we're here, let's talk about standing desk ergonomics. So if you have the option of putting a mat or a pad beneath your feet for cushion, that's ideal for you. And then ideally, if you have to work in heels, you want to take the heels off. So especially if you're going to be standing up for longer than an hour. As you can see here, you still want to have that computer eye level, still, not being too close to your computer monitor, having that distance between you and the computer, about 20 to 26, 28 inches. That way you can reduce the eye strain and making sure that your knees could be slightly bent. I mean, if you have to cross the one leg over the other for, relief off of one side, alternate between the two sides, try not to cross the one side for too long because that can lead to hip and lower back pain. So occasionally shift your weight from side to side as well. And then remember to take a load off through the day. You want to take a load off by taking a seat or perching on a stool or just moving around would help. So, every 30 to 60 minutes, move around, take a load off, and just come back and doing your work. You may even find that taking those breaks will help with productivity throughout your day as well. All right, so here's a fun exercises that we can do. So these are called workday stretches that we can do at home, or in our home office or in our regular offices. But I would encourage you guys, please stand up with me, do these stretches with me. And of course, if you have any questions, there is a Q&A. If you roll over your tab at the bottom and you can type in your questions. And then with any of these exercises, if you do have any pain with them, don't do them, stop. Locate your local chiropractic physician like myself and any of our Align Modern Health clinics throughout Chicagoland to get help, because we shouldn't have pain when doing these exercises. Okay, so our first one we are going to do here is called diaphragmatic breathing. So diaphragmatic breathing is essentially a core exercise and can lead to increased stability in your lower back. Also, it's a great stress reliever throughout your day. If you're dealing with some stress at work, doing this type of breathing will definitely help relieve the stress and tension around your back and neck muscles. So with this exercise, you want to make sure you inhale to where you get a full belly breath. So you're going to see your stomach push out, which I'm going to show you in just a second here. And then keeping your chest and shoulders still as you're doing this. So we're going to fill up our belly with air. So I'll turn to the side so you can see here, and I'll even stand up. So we're going to have one hand on our stomach and the other one on our chest here. As you inhale, see the belly fill up, and then exhale. Perfect. And if you want, you can count to 8, you can count to 10 as you inhale and exhale. So inhale and exhale. Yes. So doing this for a set of 10, 3 times a day is a great way, again, as a core exercise, taking off that stress off of your lower back and also increasing the stability of your lower back muscles. Now, don't worry, it does feel difficult in the beginning. You may find it hard for you to do this, but it takes lots of practice. So practice at home, lying on your back first. I find it easier when patients lie on their back and do this in the beginning. They can get the hang of it a lot easier and a lot quicker. And then you can graduate to sitting or standing as well. But of course, if you're noticing that you're getting a lot of back pain with this, stop the exercise, get help from your local chiropractic physician as well, and then even scheduling like a 15-minute consult to talk with your doctor. All right, so the next exercise we're going to try is called neck retractions. So this one, you could do it sitting or you could stand up and do it. For this exercise, we want to essentially bring our head back over our neck. So straighten our head up so that our ears match up with our shoulder or from the front, giving ourselves a double chin. So we might call these chin tucks or the double chin exercise. And then we're going to return to neutral. So we're going to repeat this 10 times per set. And again, you can do this 3 sets of 10 throughout your day as well. But let me show you from the side view as I sit here of how to do this exercise. And please join in with me as I do it as well. So from the side view, we got our ear canal, reach it over our shoulder, or imagine our double chin. So sit up nice and tall, relax your shoulders down and back, and push your head back, and then come back to neutral. And we're going to repeat that way 10 times. All right. So yes, and again, that may feel difficult in the beginning because we're not used to having that motion of our heads going back like that, but it does take practice. So again, practice this at home, practice it sitting if you like first, and then graduate to standing up. I do find it easier with sitting or even lying on your back. But of course, if you start to getting any pain that's in your neck or traveling down your middle of your spine or down your arms, stop the exercise and seek help from your local chiropractic physician. Alrighty, so this one here is called the slump overcorrect. So if you find yourself that you've been slumping all day in your chair, this is your time to shine because we're going to do a slump and then we're going to overcorrect that. So slumping forward, curving that spine over your body, and then we want to overcorrect or exaggerate that hyperextension by arching our spine backwards and then returning back to neutral. And again, you can do this 10 times in a row and having 3 sets and repeating that throughout your day. So let me show you from the side view here. So we're sitting here, we're gonna slump over and then arch your back, hyperextend backwards, and then back to neutral. And then slump over, and then arch, hyperextend, exaggerate that motion, and then back to neutral. Slump over, arch our back all the way back, and then back to neutral. So we'll repeat that 10 times and doing 3 sets of 10 throughout your day. This one is a great stress reliever for our upper back, mid, and lower back. So just remember, as we are going throughout our day and having all those repetitive motions, these are the joints and muscles that are getting overstressed. So doing this one is a great way to relieve that tension and, also help you mitigate and prevent that injury of your spine as well as your muscles and tissue as you're going throughout your normal day and daily activities. But once again, I repeat, if you're noticing any pain with this exercise in your back or neck, stop the exercise immediately and seek help from your local chiropractic physician. All right. So now, as we get down to our lower back, as you can tell, when you're sitting down in your chair all day, you can imagine your back is going into that C shape as what we call flexion, because we are starting to hunch over like this. And that can cause a lot of wear and tear on our lower back, spine, and joints and muscles, which is very common for reasons why people have lower back pain. But doing this exercise will relieve that tension from all the repetitive motions and repetitive sitting that you've been doing all day throughout your work week. So this one I will show you demonstrating it standing up. So essentially we're going to place our hands behind our lower back, just above our belt line, or pant line, pushing those hips forward, allowing that back to arch, and then only tipping our head back to where we're comfortable. So don't go back too far where you're uncomfortable and you fall back, because we don't want that, and then returning back to neutral. And again, we're going to repeat this 10 times. Now, of course, if you're getting any pain in your lower back or pain going down into your buttocks or glutes or down your legs, we don't want that. So stop the exercise and seek help. But let me stand up and demonstrate this one with you guys. And please feel free to join in. This is a very good stretch. So we're going to stand up here, right back here above our pant line here. And we're going to, remember, push the hips forward, arch the back, slightly tilting our head back, and then coming back to neutral. So just to pull it here as well. Remember, if you feel uncomfortable going back like this, then don't go back that far. Just go back far enough to where you feel comfortable by tipping your head back, but we don't want you to fall down. All right, so you repeat that 10 times. Also, by pushing those hips forward, at the end of that push and going and tipping back, you can exhale. That kind of gives you an overpressure for an extra stretch in that lower back. Feels amazing. And then repeat that 10 times, 3 sets of 10 throughout the day. A great stress reliever for your lower back muscles and tissue there, as well as your joints and discs. And then again, if you get pain with the exercise, stop the exercise and get help. All right. So let's not forget about our hands and our wrists and our forearms, especially, dealing with those keyboards or our mouse that we cannot properly set up in an ergonomic position. I get a lot of patients that come in with numbness and tingling and wrist pain, and they're not quite sure why. But I always ask them, do you work at a computer desk? Do you do a lot of typing? Yes. So here is a great way to relieve that tension throughout the day as you're typing and using the mouse. So for the first one, with the wrist motions, we call this active range of motion. So just taking our wrist through all the motions that we do throughout the day. So like we call this flexion, we call this extension, and then we got ulnar and radial deviation, so moving our hands side to side. So going from A to B to C is a great way to stress these joints and muscles around our hands and wrists. Again, holding it for about 5 seconds, doing a set of 10, and then as well as 3 sets of 10 throughout your day to get that maximum benefit of doing this stretch. The next stretch is what we call a wrist stretch. So pushing our hands like this and kind of apply resistance from the other hand and holding that for 5 to 10 seconds. And then the other one is doing this way here. Great. And you might even feel some of that in your forearms going to your elbow, because that's where those muscles attach, coming from here, and those ligaments and tendons, as well as you may even have some tightness in the wrist joint around where the other attachments are. So as you are stretching those hands, and again, if you start to get a lot of pain or numbness or tingling, stop the exercise and seek help. Now, don't forget the other hand though. So we got 2 hands, 2 wrists. Let's do both hands. So again, having that stretch, holding it for 5 to 10 seconds in this direction, as well as this direction. Do a set of 10 and then repeat throughout the day for 3 sets of 10. I also encourage you to try the other stretches on the table as well too. If you want to get more of a stretch, you can use a table or your desk around you to actually stretch in the same motion instead of using your hand. Same time of holding 5 to 10 seconds, same number set of 10, and doing 3 sets of 10 throughout your day. The next one we call is pronation and supination. So taking our arm and going opposite up and down. So for these forearm muscles here that we use, so we don't think about those muscles throughout our day, but they are being used. So if we want to take these muscles here and do that, that will give you that motion there, like you did with your wrist, will give you that same feeling here. So palm up, palm down, palm up, palm down. And doing that rotation motion will help a lot with those muscles that are aligned in your forearm. So after sitting all day and doing those repetitive motions with our mouse and our keyboard and wrist, these are the areas that will become most overstressed. And doing these exercises and these stretches will definitely help mitigate that area and prevent you from injury and pain. All right, so no matter what, at least get up every 30 to 60 minutes and be sure to stand up and just move. Our bodies love movement. This is why we feel better when we move, because our joints and our muscles, they need it. They need to move. So don't sit too long, don't stand too long. Every 30, 60 minutes, get up, move around, stretch. It's a great way to relieve all the overstress from the repetitive movements that we do throughout our day, just from our daily activities, and helping us to mitigate around that pain and injury that we can get from overstressed muscle and joints. A good pro tip here is, it's a great time for water break. So be sure to hydrate throughout your day. Getting enough water in your body is also great for our muscles and joints and our skin as well. Recommended is drinking 1/2 ounces of weight. For example, if I weigh 200 pounds, I try to get in 100 ounces of water a day. But other than that, let's get up and take a water break. And then if you have any questions, please feel free to notate that in our Q&A box there, and we will start answering questions. So again, thank you all so much for joining us. Please, again, type any questions in the Q&A feature on Zoom. Just remember that if you're doing any of these exercises or you are experiencing pain right now, we do offer a free 15-minute consult personalized to you, and you can schedule that by visiting us at alignmodernhealth.com or by calling the number to schedule with our scheduling personnel at 773-692-6700. You also see here on the screen that we do offer, or we take insurance here. We do offer free verification of the insurance as well too, so we can tell you if the services that you are seeking are covered. Right. So let's go to our questions now. Yeah, so again, one of the questions was, is there a calculation on how to figure out how much water you should be drinking a day? So yes, so again, if 1/2 of your weight in ounces, so if I weigh 200 pounds or however much you weigh, take that number, divide it in half, and then put ounces. So 200 pounds would be 100 ounces a day for that person. Great, yes. So yeah, so please feel free if you do have any questions to use your Q&A feature on your Zoom. Yes. So great question. What time of day do you recommend stretching? So I always say, you know, when you first get up in the morning, that's a great time as you get in your day, you get going. It's nice to warm up those muscles, just like, you know, sometimes in the wintertime, we might have to warm our car up before we get to it. Warm up those muscles before you start your day. And then in the middle of your day, like I said, throughout your day, as you're sitting for, you know, however hours you work, get up every 30 to 60 minutes, do some of those stretches, even if it's just like 2 or 3 minutes, getting up and moving around and moving. And then at the end of your day, when you get home, before you go to bed, another great way to relax and get those muscles to relax is to do those stretches right before you go to bed as well too. Get a great night's sleep and you can feel refreshed. All right, good, good. So should we stretch on our off days too? Most definitely, yes. So those repetitive motions that we do every day, they don't stop just because we're not working. So like I said, we are creatures of habit. So we tend to have a routine that we do in and day out. So there's a lot of repetitive motions that go into that as well too. So you most definitely could do those stretches on your off day. Yeah, so it's 10 to 30 seconds enough for standard stretches. So, I say anything is better than nothing else. So if you only have 10 to 30 seconds to do some standard stretches, fine, perfect. It may not be the ideal, but at least you're getting in some type of stretch. I would say anywhere from 2 to 3 minutes would be more ideal if you on a crunch time. But of course, 5 to 10 minutes spending time on those stretches is gonna help. But yeah, if you only have 10 to 30 seconds to do some standard stretches, get it in. That's better than zero stretches. All right. Well, that's all the time that we have for today. And thank you all so much for coming to our webinar about workstation ergonomics. And again, if you do have any pain or you are experiencing some type of symptom or condition, please feel free to reach out. We are here to help and schedule a 15-minute consultation with your local Align Modern Health provider.